Here's a comprehensive explanation of the heart-lung machine, covering all the aspects. 1. Introduction. The heart-lung machine, also known as the cardiopulmonary bypass (CPB) machine, is a sophisticated medical device that temporarily takes over the function of the heart and lungs during cardiac surgery. This allows surgeons to operate on a still and bloodless heart. Since its invention in the 1950s, it has revolutionized cardiac surgery and made complex procedures like open heart surgery possible. Definition. A heart-lung machine is a medical device used during open heart surgeries to maintain the circulation of blood and the oxygen content of the body while the heart is stopped. 3 types. There are several types of heart-lung machines based on their usage and technological components. Roller pump machines, traditional type using roller pumps to move blood. Centrifugal pump machines use spinning cones to create flow, causing less blood damage. Portable heart-lung machines used in emergencies or in field hospitals. Integrated CPB systems combine heart-lung functions with monitoring systems and oxygenators. #4 Parts. Main components of a heart-lung machine include: pump, acts as the heart, propelling blood through the body. Oxygenator, acts as the lungs, adding oxygen to the blood and removing carbon dioxide. Heat exchanger, regulates blood temperature. Arterial filter, removes air bubbles and clots from the blood. Venous reservoir, collects deoxygenated blood from the patient. Tubing system, carries blood between the machine and the patient. Cannulae, tubes inserted into blood vessels to connect the patient to the machine. #5 Uses: open heart surgeries, e.g., valve repair, replacement, coronary artery bypass grafting, heart transplantation, repair of congenital heart defects, aortic aneurysm surgeries, emergency support in cardiac arrest, ECMO variation. Precautions: ensure all equipment is sterilized to prevent infections. Monitor anticoagulation levels, usually heparin, to prevent clotting. Maintain air-free tubing to avoid air embolism. Continuous monitoring of perfusion parameters, oxygenation, pressure, flow. Cross-check patient's blood type and compatibility with machine tubing if blood is involved. Careful priming of the machine to avoid introduction of bubbles. Advantages: enables life-saving surgeries that would be impossible without it. Provides controlled environment for cardiac procedures. Allows for precise management of blood temperature and oxygenation. Reduces surgical risks in complex procedures. Can be used as a temporary life support device, e.g. ECMO. Risks and complications: blood clotting or bleeding due to heparin use. Air embolism, bubbles entering the bloodstream. Inflammatory response due to contact between blood and artificial surfaces. Organ dysfunction, particularly kidneys and lungs due to changes in blood flow. Neurological issues, such as stroke or cognitive dysfunction post-surgery. Infection risk, particularly if sterile protocols are not followed. 9. How to use step-by-step procedures. Step 1. Preoperative setup. Assemble and inspect the heart-lung machine. Prime the machine with a priming solution, saline blood products. Calibrate monitors and sensors. Step 2. Cannulation. Insert venous cannula into the right atrium or vena cava. Insert arterial cannula into the aorta. Step 3. Initiating bypass. Start venous drainage to the reservoir. Activate the pump to circulate blood through the oxygenator. Return oxygenated blood to the body via the arterial cannula. Step 4. Monitoring. Continuously monitor blood pressure, oxygen saturation, temperature, and flow rate. Adjust pump speed and oxygenation settings as needed. Step 5. Surgical procedure. Surgeon operates on a non-beating bloodless heart while machine maintains circulation. Step 6. Weaning off. Gradually restore heart function. Decrease pump flow slowly as the heart takes over. Remove cannulae after confirming stable cardiac function. Step 7. Postoperative care. Monitor for any complications like bleeding or organ dysfunction. Clean and sterilize the machine after use. 10. Conclusion. The heart-lung machine is a cornerstone of modern cardiac surgery, providing life-saving support during complex procedures by temporarily replacing the heart and lungs functions. Despite potential complications, its benefits far outweigh the risks when managed by skilled professionals. Ongoing advancements in design and safety features continue to improve outcomes for patients undergoing cardiac surgery. Thank you. Have a nice day.